I founded the National Addiction Foundation to help battle the pandemic of drug addiction in America, and especially in my backyard. I've been blessed to be in the behavioral health industry for 16 years. I've owned and operated facilities, I've built facilities, I've held every job from when I first got sober, from a house manager all the way up to executive director and CEO of many different facilities that I've worked in and or created, founded, built, and that sort of stuff. And so one of the most painful things for me throughout that whole process was seeing how few people we could help. What happens is when I would just look at our admissions departments, or when I worked as a director of admissions for a facility and answering the phone calls that were coming in, or in call centers or that sort of thing, there was a very little percentage of the population that was calling in we could help. And so there were so many people that were in crisis, and so many people that were just feeling hopeless and helpless in battling their addiction. They just didn't realize options that were available for them out there. And so in my experience, I've learned over the years and years of being in the industry, I've learned that there are a lot of resources available to people, okay? And so why I created the National Addiction Foundation is to connect people with those resources. One of the main points, one of the main principles of our foundation is to connect people with the appropriate care, okay? So often now you call into a behavioral health center or that sort of thing, and they'll say, oh, you got insurance or you have money, great, we're perfect for you, okay? The reality is most centers are not perfect for everybody. Everybody has individual, everybody are individuals. They have unique problems, but they're not terminally unique. Okay, if you understand what I'm saying. So what happens is it's really, really important to connect the patient or the addict that is struggling with addiction with the appropriate care. Okay, if somebody has trauma issues, they need to go to a program that deals with trauma issues. If people have heavier mental health issues, they should go with somebody that's a little heavier on the mental health. If they have this and that, we're just connecting people with the right care is critically important. And I believe there are in this industry, there's many different types of treatment modalities. Okay, and so what we do is we want to connect those people to the appropriate modality that's going to help them deal with their issues, so they can create real systemic change in their lives and in their addiction. Okay, so often people are just dropping into centers that are not the most appropriate for them, and that's not going to do the job. Okay, and as behavioral health providers and as people that have been in the industry and pioneers in the industry, we need to do a better job. Okay, we need to make sure people are connected to the appropriate care, and we have to do that. We absolutely have to do that. So the National Addiction Foundation too has a few different components. Okay, what it is we've created a database of centers all across the country. Homeless shelters, Medicare, Medi-Cal, free programs, insurance, HMO places, PPO, all that sort of stuff. And so what we do is we've kind of created a network of facilities, and indigent and free, and that we created a network of facilities that we know what they do. Okay, we've assessed what their programs are, we've assessed what their clinical criteria is, we assess what they're good at, what they're not good at, and so what we do is we then do free mental health and chemical dependency assessments, and we connect those people to the resources available to them. Secondly, when you're dealing with the indigent patient population, when dealing with addiction, there are limited resources. There are resources, but there are limited resources. So what we do is what's very important is when you're helpless and homeless, or you're dealing with addiction, and everybody else has left you, your family's not talking to you, you don't talk to your kids, and you're just helpless and hopeless, living on the streets. One thing that is so important is love. And so one thing that the National Addiction Foundation does is, I don't care if you have money, don't have money, have insurance, don't have insurance, it doesn't matter to us. You're going to receive the same service through our foundation and our call centers and our recovery advocates that are on the other end of the phone. You're going to receive the same service no matter what the case is. So, for example, if somebody's indigent or is not willing to go to treatment, and somehow we get them on they call into and they're in crisis, they call into our National Addiction Foundation. What happens is our foundation, the recovery reps, the recovery advocates are going to call you back in 3 days. Call you back in 4 days. Call you back even if you're not asking for it. We're going to call you back and we're going to shower love on you. We're going to hold your hand through the process and getting into treatment, whether it's an indigent treatment center, whether it's any other type of treatment center, that sort of thing. We're going to hold your hand through the process and helping you getting the help that you need to address your issues. Okay, we are a nonprofit organization. Okay, so we do a lot. We do fundraising. We do all sorts of stuff. We're not looking for money from anybody or any place or anything. This is a free nonprofit foundation that we just help those in need and shower love on those that are not ready yet, and try to connect, especially the indigent patient, to resources available to them. Some things that a lot of what they call basically tricks of the trade or knowledge, okay, knowledge that we've gained over the years. For example, one prime example, because I do a lot of legal intervention type stuff, okay, so I get, when somebody's in crisis, family calls me, kids in jail, and I help deal with that and interface with the judges and that's kind of been in my wheelhouse, because me personally, I had scrapes with the law prior to me getting sober at 26 years old, and so I have a lot of experience with that, okay? And so, like, for example, one example is that people don't know that getting released from jail is a qualifying event to get insurance year round. People don't know that. So when a patient gets arrested for a DUI and they go to jail and then they get out, then they get out with that paperwork. A mother can buy a Obamacare policy or something for their loved one, and they can get help. Okay, so just knowing those little tricks, and there's a lot of them where people, and what we do at the National Addiction Foundation is we just guide them through that process. Okay, we don't sell insurance, we don't do any of that. We just guide them through the process and helping them get coverage, helping them get support that they need in order to create systemic change in their addiction. And we're very, very proud of what we do. We're excited about it. You're going to start seeing national ad campaigns on TV and that sort of thing, because this is killing our generation. Here in Orange County, California, where I'm located, this is the number one killer. Opiate overdoses is the number one killer of our youth between 18 to 25 years old. The number one killer. And we cannot allow our children to die, and they don't have to, okay? And so, that's the reason why I founded the National Addiction Foundation, and we're very, very proud. It's a free resource available to anybody. And so, there's, the 800 line, we just want to blanket it out there and get it in as many people's hands as possible, and we're super excited about what we're doing. And we want as much support as we can, we want as much support from anybody, and it's just a free resource that's available. So when families and stuff are in crisis, getting honest, ethical direction in how to deal with what they have going on is very, very important, okay? And is something that is lacking in our industry. So, that's the premise that the National Addiction Foundation is really kind of founded on, is that we're going to help direct the loved ones or families of loved ones that are going through crisis. And also too, it's as simple as, let's say, for example, a mom finds a pipe in a bedroom, okay? I found this in my kid's room, what is it? We know. Take a photo of it with your phone, send it in, we'll tell you. So we have the knowledge to help support, people that are dealing with addiction and also mental health issues. So we have the skill set and the professionals to help support it. And, we're super proud of what we do. And so yeah, if anybody needs any help, or if you can, if you need to, if there's anything we can do from the National Addiction Foundation, or anybody needs any help, we'd love to help them. So it's a free resource available to everybody. So, I really appreciate you coming in and wanting to talk about that. So.